We are at the corner of Nolana and Jackson in McAllen, and a few months ago we saw this building being put up and now it's finished. So let's take a look inside and see what exactly it is. Check out the McAllen Foot Center's newest location. Today, we spoke to podiatrist Dr. Rene Rodriguez all about diabetic foot ulcerations, something that unfortunately a big portion of our Valley community suffers from.
Diabetic foot ulcerations are open sores on the bottom of the foot, typically, and they occur in 15% of the diabetic population.
Dr. Rodriguez tells us treatment options vary from patient to patient.
They are definitely treatable, but there are different factors that go into treating a diabetic ulceration. It's important to keep your blood sugar at a good level. Good circulation is really important, and taking off the pressure is definitely important in treating a diabetic foot ulceration.
After learning just a little bit about diabetic foot ulcerations, it was time for a quick round of true or false with Dr. Rodriguez.
Diabetics can have diabetic neuropathy, which is the loss of sensation to their feet. You should seek treatment if you have corns and calluses, because you may not feel the pain that's typically associated with corns and calluses. And if the corns and calluses get worse, they can lead to diabetic foot ulcerations.
True or false? It's normal to experience burning sensations to your feet.
Burning sensations to your feet, that is not normal. So typically in our diabetic patients, if they have a condition again called diabetic neuropathy, that can lead to numbness, tingling, and burning to your feet. Diabetes is one of many causes of nerve damage.
Is it true that people with diabetes should never be barefoot?
This is true. When people with diabetes are walking barefoot, they are at risk for injuring their toe. They can stub their toe, they can step on a piece of glass. This can cause an open sore, and that can lead to infection.
And lastly, is it true that people with diabetes should inspect their shoes daily?
Yes, that is true. You definitely want to look at your shoes on a daily basis to make sure they fit appropriately, to make sure that they're not causing any increased friction or pressure to any part of the foot. And you also want to shake your shoes and make sure you don't have any debris in there. The last thing you want to do is walk on a small pebble or a rock that may be inside your shoe. You may not feel it, and that can cause an ulcer.
To learn more, give the McAllen Foot Center a call at 956-682-4187 or visit their website at McAllenFootCenter.com.